Believe it or not, this is becoming one of the most beneficial devices in the healthcare ecosystem. An ecosystem BioNexus is working hard to expand. Hi, my name is Gavin Montaigne, and for the past 5 weeks, I've been interning at BioNexus Kansas City, where their mission is to enhance digital healthcare. Working alongside Dick Flanagan, the CEO of BioNexus Digital Health, my task was to visually represent the digital health ecosystem in a way that a better understanding can come of it. My employer chose a visual representation because they knew it was a more accessible and creative way to consume and deliver data. When I first started at BioNexus, I thought to myself, what exactly is a digital health ecosystem and why does it need to be understood? In order to uncover the answers to this question, through my empathy work, I interviewed Flanagan. I gathered that a digital health ecosystem is an ecosystem constructed of standard healthcare entities such as hospitals, clinical laboratories, insurance companies, etc., and works in tandem with any digital technology that looks to improve the processes that take place in the healthcare world. As you can see on my slide, the current visualization of the ecosystem breaks down the ecosystem to its building blocks, which are described as entrepreneurial support, economic development, and economic developers. Even when broken down, the complexity of the ecosystem remains. If the role of BioNexus is to work on the intersection between healthcare and information technology, why can't this digital health ecosystem be better understood? The answer to this question is that the visual representation of the ecosystem specific to KC is underdeveloped and is hindering public understanding of the field. This in turn hurts the amount of capital available to grow and support the ecosystem. Without a significant rise in understanding towards the ecosystem, the efficiency of the ecosystem will lack crucial components such as funds in order to enhance and streamline services people rely on for effective healthcare. When I was first faced with this problem, I thought in order to visually represent something like the digital health ecosystem, I was going to have to make a graph comparing earnings or growth of the ecosystem. However, this solution does not allow those interested in the ecosystem to engage with BioNexus or the ecosystem. Along with this, I knew that since digital health was new to BioNexus, the company, that my project would have to act as a stepping stone of sorts to BioNexus as well as the ecosystem. With this in mind, with the help of an amazing staff at BioNexus, I constructed Project Spotlight, a nexus of data and interest. During my internship, I was tasked with profiling over 200 companies, as well as validating data that worked to depict the size and profitability of each company. This worked so that I could get a better understanding of the ecosystem myself and relay that message. Using this data, an interactive roadmap can be formed in order to effectively show investors and entrepreneurs the viability of the ecosystem. The map will feature companies of all sizes, revenue, and annual and founding dates so that a clear conclusion can be drawn about the ecosystem itself. These companies can be differentiated via filtering options that allow users to see traits such as employee count and which sector of healthcare the company caters to. This is so that the user can see how developed a certain sector of healthcare is in KC. Per my employer's request, the map will not overlay BioNexus' website in order to keep viewers engaged, so I propose that each company listed on the website have a tile that pops up when you hover over a chosen company. This tile will give a brief description of the company as well as a link to their website if the user wishes to explore more about this company. Project Spotlight is able to nullify my employer's pain points of less understanding about the ecosystem as well as act as a data distribution by being a digestible and interactive tool. To get the most benefit out of Project Spotlight, a timely release is a must. This is because if the map works as intended, then only time can gain the digital health ecosystem the traction needs and able to grow. Along with this, more time will allow BioNexus to collaborate with more companies. With this in mind, I formed a 3-month process so that BioNexus could get more use out of this. The first step would be to see what platforms are in use for BioNexus and assess what can be done through said platforms, followed by affordability and cost estimation. This will get BioNexus in the process of meeting with a marketing partner so that they can get more cost and estimation down. After the page has been released and the tiles have been uploaded, my employer can use Squarespace data tracking apps so that they can see the progression of Spotlight. As BioNexus is still in the negotiation process with other companies like MBB, which are advertising, it's hard to calculate the general funds needed to get Product Spotlight off the ground. However, since BioNexus is a nonprofit organization, getting outside investments is needed. Along with this, BioNexus would rely on philanthropy as well as general fundraising in order to get this off the ground. In the event that not all of our costs are covered, my employer has set a $10,000 or less expenditure budget, as this has been more or less the cost to promote in the past. And finally, any connective company data that may be available to promote and reach out to gain a wider audience for Project Spotlight is needed as well. With this approach, BioNexus has the ability to make this one of the most beneficial devices in the healthcare ecosystem and in turn deliver better care. Thank you.